Ontario's first case of the Brazil variant of COVID-19 has been identified in a Toronto resident with travel history from Brazil. Some medical professionals call the uninterrupted travel to and from Canada shameful, but some advocates are actually calling on the federal government to loosen travel restrictions. We break it all down for you. The first case of the variant from Brazil has landed in the province, identified in a Toronto resident now hospitalized. They recently traveled from Brazil.
We've invited the variant here by running those flights.
Scientists and medical professionals are concerned the variants are more contagious than the original coronavirus. The one from Brazil particularly problematic because of the unknowns.
We know more about the one that was discovered in the United Kingdom. I think the key questions with the variant discovered in Brazil is to what extent will it evade vaccination?
And without restrictions, they will continue to enter the country. While Ontario's numbers, hospitalizations and positivity rates seem to have plateaued, the province is still concerned about how the new variants will spread in the community. But the Canadian Civil Liberties Association says not all travel is for leisure or pleasure, and current travel restrictions could infringe on citizens' mobility rights, punishing people who are out of the country for valid reasons.
There are people who might be out of the country because they are looking after, a sick relative. There are people who might be getting medical care that isn't available in Canada.
Requiring hotel quarantine, which could cost up to $2,000, may be harmful to lower-income Canadians, especially with no evidence that they aren't isolating.
We're going to effectively detain 100% of the population that's returning, because we're concerned about those few that don't follow the rules. As much as we may not want the Brazilian variant here, it's not a problem if someone comes in with that variant if they self-isolate and don't pass it along to anyone else.
But experts argue the consequences just aren't worth it.
All we're doing, like a good goalie, is catching most of the shots. But like any goalie, we can't save them all.
Epidemiologist Colin Furness says an essential trip should be defined by the consequence of the action.
How many people ought to die for the trip that you need to take? That's the question. How many people is it okay to have died for the trip that you need to take? If you travel now, the results are going to be catastrophic, and we don't need that. Nobody needs that. We can wait.
But unlike New Zealand and Australia that have had effective travel restrictions, Canada isn't in the same position. With a large immigrant population and land border, it may be unrealistic to exclude travel altogether.
We do have to appreciate that we are a country that is, very connected to other countries.
Toronto Public Health has confirmed that the resident that did travel from Brazil did follow quarantine rules upon arrival. For City News, I'm Yazdani.